Our next speaker is Daniel Giovenco. Excuse me. He's assistant professor of social medical sciences at Columbia University School of Public Health, and he studies population patterns of non-cigarette tobacco product use with the particular focus on electronic nicotine delivery devices. His most recent work examines how the promotion of lower-risk tobacco products differ across neighborhoods and how this may influence harm reduction behavior and subsequent health disparities. Thank you.
Hi, everyone. Good morning. My name is Danny Giovenco, and I study population patterns of diverse tobacco product use. And most of my research focuses on ENDS use and how it differs between demographic and behavioral subgroups. And as Maciej said, I also study trends in the tobacco retail environment, including product sales and also tobacco advertising in communities. So today, I want to present a broad overview of ENDS use in the United States. There have been hundreds of studies describing patterns of use in various geographies and among different populations. So what I decided would be most useful today is to present data from the leading tobacco and health-related surveys in the United States. So for youth prevalence data, I'll present some estimates from the National Youth Tobacco Survey as well as the Monitoring the Future study. And for adult data, I'll highlight some findings from the National Health Interview Survey, the National Adult Tobacco Survey, and PATH, the Population Assessment of Tobacco and Health. So all of these surveys are funded or administered by federal health agencies such as the CDC, NIH, FDA, and because of their complex sampling design, they produce estimates that are nationally representative of tobacco use behaviors. And I'll finally conclude by talking about some possible reasons for the differences we're seeing in rates of ENDS uptake between groups. But I think that these surveys will provide the best snapshot of who uses ENDS, what types of products they're using, and potentially why they're using these products. Experimentation of ENDS products is common among youth. Over a third of high school students have tried a vaping product, and we see the highest rates among male, white, and Hispanic students. Now, most of these experimenters, in fact, over 80% of them, have also used other tobacco products. So these are typically youth who are experimenting with all different types of products and are engaging in riskier substance behaviors. Now, even though trial of ENDS is high, progression to really established regular use is fairly uncommon among youth. So let's go to the data. This graph shows the percentage of youth who have used ENDS at least once in the past 30 days. So you can see generally higher among males, white, Hispanic, and other racial and ethnic groups. And over half of current tobacco users have also used ENDS in the past 30 days. Now this measure, past 30-day use, is really our field's standard to assess current tobacco use among young people, but it has obvious limitations, right? Because this past 30-day use group also contains students who have tried ENDS once or twice in the past 30 days, but are by no means regular users. So I want to break this graph down a little bit. This is the same exact graph, but it's broken down by frequency of use. So the red part of each bar represents the percentage of students who are using these products every day or just about every day, 20 to 30 days in the past 30 days. So you can see across the board, rates of daily or almost daily use are under 4% among all groups, except for that group of current tobacco users. So these are the youth that are really using these products frequently. Rates of daily use is extremely uncommon among black students as well as students who have never used any tobacco products. So now that we know a little bit about the types of youth who are using these products, let's talk about the products that they may be using. 43% of current users reported using a flavored product in the past 30 days. And this is actually one of the lower estimates that I've seen. Certainly lifetime use of flavors is higher. Additionally, many youth, as Jennifer mentioned, believe that the ENDS products that they're using do not contain nicotine. And indeed, it is possible to buy e-liquid that's labeled 0 milligrams of nicotine, although I should say there have been some recent studies documenting that even no nicotine products often do contain trace amounts of the drug. So in 2015, the Monitoring the Future study asked high school seniors about the content of their e-liquid the last time that they used a vaping product. And only 23% said that their product contained nicotine, while another 2/3 reported that it was just flavoring. But I say that with the same caveats, that they may have unknowingly consumed nicotine. There's also some evidence from this study that some youth may be using vaping products to vape marijuana or THC or hash oil, but we don't really know the exact prevalence of this behavior yet. Experimentation, actually curiosity and just a desire to know what it's like is named as the most common reason for trying vaping products. But among current users, it's things like flavors, peer use, and also the perception that they're using a lower risk product that are the real drivers of use among current users. And despite that really strong correlation between tobacco use and vaping, smoking cessation is rarely listed as a primary reason for vaping among young people. So this graph shows the most common reasons for vaping among current users. So you can see only about 14% of high school students who are current users are using them to quit tobacco products. All right, so now I want to switch gears a little bit and talk about vaping behaviors among adults. Experimentation is much lower among adults than youth. About 14% of adults have tried a vaping product, but we see a lot of the same patterns. Higher rates of use among males, whites, also young adults, and people with a history of smoking. Unfailingly, those groups have the highest rates of use. Nationally, regular use of a vaping product, so some days or daily use, is generally low, under 4%. But as we'll see in a minute, current use is substantially higher among people who are current smokers or people who have recently quit smoking. So this graph represents the prevalence, the percentage of adults who are someday or daily end users. And we see similar patterns as the youth data, higher among males, whites, young adults. And I want to do the same thing here and break down this graph by frequency of use. So the red part of each bar represents daily use, under 2% among all groups, demographically at least. But things change when we look at these data by tobacco use status or smoking status. So higher rates of use among current smokers and the highest rates of current use among recent quitters, people who have quit in the past 3 years. 1 in 5 of those individuals are using vaping products some days or daily. If we break this down, we see that daily use in particular is much higher among recent quitters than any other group. And this may suggest that many smokers are successfully quitting by more intense, regular use of vaping products. This would support a lot of smaller studies showing that frequent, intense use of vaping products is associated with better cessation outcomes. Although obviously we can't say that with certainty here given the cross-sectional nature of the data set. What this graph also illustrates is that regular vaping among people who have quit smoking a long time ago or people who have never used tobacco is very, very rare. So ENDS do not seem to be attracting people who have quit tobacco a long time ago or who have never used before. Media studies or media stories often mention the appeal of flavors to youth. It's very common, but flavors are appealing to adults as well. The majority of current ENDS users are using a flavored product, and fruit, menthol, and candy flavors are named as the most popular flavors. The PATH data set, the Population Assessment of Tobacco and Health, is really great because it has very detailed questions about things like device type, including can you add your own e-liquid to the device. That's really indicative of the tank-like systems, and we find that there are major differences by smoking status. So current users are much less likely to use those more advanced vaping products, whereas people who have quit smoking are more likely to use products where you can add your own e-liquid. So what we think is happening is that current smokers are using the cig-alike devices, like the Views picture to the left, whereas former smokers are more likely to use the more advanced vaping products. And again, this is consistent with some smaller studies showing that there are better cessation outcomes with more advanced second and third generation products. Where youth and adult data really begin to diverge is when users are asked about reasons for using the devices. So you can see from this graph that adults are much more likely to cite harm reduction reasons or tobacco cessation or tobacco reduction. So 72% of current users believe that these devices are effective as cessation aids. Definitely. So as we've learned, tobacco use, smoking specifically, is the strongest correlate of ENDS use. So what we should expect to see is that groups with the highest rates of smoking should also have the highest rates of vaping. In the United States, whites and blacks have the highest rate of combustible tobacco product use. However, black smokers are much more unlikely. Black smokers have the lowest rates of ENDS awareness and uptake, while whites have the highest. So when we typically talk about substance use disparities, we have the most concern for groups with the highest rates of use. But when it comes to ENDS, a potentially lower risk product, higher rates of harm reduction among certain groups could worsen health disparities. It could widen health disparities if other groups continue to smoke. So there is some concern that disproportionate rates of harm reduction may actually exacerbate smoking-related health disparities. So I want to illustrate this with some data that I pulled from the National Survey on Drug Use and Health. This graph shows the prevalence of combustible tobacco product use, so either cigarettes or little cigars, cigarillos, and it's broken up by race. So you can see that from 2010 to 2014, rate of combustible product use began to diverge between white and black Americans. There was a steeper decrease among white Americans. 2012 was also the year when sales of e-cigs really began to spike. So if ENDS are contributing to smoking cessation, then disproportional rates of harm reduction or uptake could potentially be problematic. So much of my current research has focused on reasons for the differences we're seeing in ENDS uptake between racial and ethnic groups, particularly between white and black smokers. One possible reason may be differences in perceptions of harm for ENDS products. So black smokers are significantly more likely to believe that ENDS are just as bad or worse than cigarettes, whereas white smokers are more likely to believe that they are less harmful. That's one potential reason. Another potential reason for differences in uptake is product availability and promotion in communities. So my colleagues from Rutgers University and I located every vape shop in the state of New Jersey last year. And I think everyone knows what a vape shop is, but for those who may not, they're retailers that specialize in the sale of ENDS devices and accessories. So we located every vape shop and we characterized the types of neighborhoods in which they were opening. And we found that vape shops were more likely to open in places where tobacco retailer density is higher. That made perfect sense to us. These products have appeal to smokers looking to quit, so it makes sense that they would open in areas where tobacco retail is high. However, we found that vape shops were less likely to open in places in census tracts with a higher proportion of African American or Latino residents. So if I had to give an overly generalized name to the types of communities in which vape shops are opening, I would call it middle-class white suburbia. In New Jersey, at least. So these are places where median household income is kind of middle of the road and where most of the population is white. But even when we consider traditional tobacco retailers that may sell ENDS, such as convenience stores or gas stations or drugstores, retailers in urban settings are less likely to carry these devices. So in a separate study, we examined the marketing and availability of ENDS near schools across the state of New Jersey. And I use these two maps as really illustrative examples of consistent patterns that we found. So all the dots on these maps represent tobacco retailers, and the blue dots are those that sold ENDS, and the red dots are those that did not. And what we found is that in urban settings, for example, like the school district on the left, even though there were more tobacco retailers, they were less likely to carry ENDS products, whereas in more suburban settings, fewer tobacco retailers, but ENDS were ubiquitous. They were everywhere. And I could tell you from having visited every store in these samples, in suburban settings, ENDS were not only more available, but they were more heavily advertised and promoted as well. So it's difficult to summarize all of the literature on patterns of ENDS use in 15 minutes, but let's review some of the key points that are really consistent across most studies. ENDS use among youth tends to be higher than among adults, but we see the same patterns in both groups, that males and whites are reporting the highest rates of use. Without fail, tobacco use is the strongest predictor of ENDS or e-cigarette use. Specifically, use is highest among current smokers, and it's really high among people who have recently quit. And regular use among people who have never used tobacco is rare. However, even though tobacco use is this universal correlate of ENDS use, we do see differences when it comes to reasons for use. So youth use tends to be more recreational in nature. It's not to say that some aren't using for smoking cessation, but generally it's more recreational, whereas adults are primarily using ENDS products to reduce smoking or as a means of harm reduction. And finally, there's emerging evidence that there are differences in uptake by race, and research is underway to help identify what determinants of those differences are. And I think any real disparities resulting from harm reduction or different rates of harm reduction will only be known once we fully understand the health effects of ENDS, as well as their efficacy for smoking cessation. So thank you for having me today. Happy to answer any questions.